Hello, YouTube. Good morning. So, YouTube crew, I'm going to be prioritizing Instagram in terms of moving my tripod around so that it has a good angle. So, my advice to you all is to go onto Instagram to watch the demonstrations that I'm going to give, because I may end up being out of frame here on YouTube because I'm trying to just focus on keeping one apparatus in frame versus having to do two. And I'm choosing Instagram to be that platform. So just to let you all know. Good morning, crew. Welcome to the PT on Ice Daily Show. My name is Julie. I am a member of the Older Adult Division, and I am coming to you live from my garage. So this morning, what we are going to dive into are fitness forward tools that you can use in acute care. And I'm going to do my best to demonstrate some of these tools that you can use to start loading these really sick folks up early. All right, so we are going to dive in first by talking about the most important tools that you need to have with you as you go through the hospital and you go visit your patients in their rooms. So number one, the most important tool that you need is the right attitude. You have to have the right attitude about this. So let me unpack that. Bringing fitness forward care to sick older adults in the hospital, it is not about getting them to do a sexy deadlift with a dumbbell. It's not the sexy thing. It is not, holy crap, I just got this patient, they're in a hospital gown, they're super sick, and they're doing a deadlift with a dumbbell in the hospital. It's not about that. It's not about being able to get the video of that or the picture of that and being able to share that. That is sexy and that is cool and it is badass. However, the meaning is deeper. What the attitude you need to have is that you have this beautiful, amazing opportunity to plant a fitness forward seed in this patient who is sick, who has a ton of medical complexity, and you only get to see them potentially one time. You've got one shot to plant that seed and potentially be the catalyst that sets this person up on a better trajectory of health. That's an amazing opportunity. And I would encourage you all to be obsessed with that opportunity, okay? Every single time I would go into a room, I thought, wow, I have this opportunity. I've got one shot. I could be the catalyst that changes their lives. And the thing about you all who work in acute care, man, you are doing some dirty work, right? You are seeing folks, whether they're young or old, they have multiple types of diagnoses and medical complexities. You are seeing them at their worst. And you are seeing them in a very, very vulnerable situation. The fact that you are able to plant that seed, yet you don't get to see the sexy outcome, and yet you give them your whole heart and whole soul is so important. And it's hard to be in acute care and know that you're not going to get to see a sexy discharge where a patient is lifting a super heavy barbell or they are going all out on an assault bike. You're not going to see that. And that's tough. But you have to reframe it to be, I am going to be obsessed with having the attitude that I could go into every single one of these rooms, plant the seed, and the patient is able to walk into an outpatient clinic. They want to do fitness forward care because I planted that seed. And I think that it's an incredibly, incredibly important story to tell yourselves so that you can continue to have the motivation to go in and see these folks who are sick day after day. And many times you may not actually get them to do the cool fitness forward stuff. Okay, so that's the most important thing, is having that right attitude. Okay, so the second tool that you're going to need to bring along with you to every single room is a backpack. All right, you absolutely need a backpack. So this is not the backpack I used in acute care. I used the backpack that they gave us as like a Christmas gift one year. This is a nomadic. This is my travel backpack. This is a very sturdy but very expensive and nice backpack. I do not recommend getting something like this to go into hospital rooms, okay? But I do recommend that you get something that's sturdy because you're going to be carrying around a lot of stuff in it, all right? So get yourself the backpack. So what are we putting in the backpack? You're going to put weights in the backpack, all right? No, most acute care therapy offices do not have weights, okay? But you can bring your own, okay? So I would bring a 15-pound dumbbell and an 8-pound dumbbell, and I would put that in my backpack. Now, some of you are not able to bring a backpack potentially into the patient's room. Cool, then you bring it around and you leave it at the nurse's desk, okay? But the idea here is that you're bringing everything with you so that there is no excuse that you don't have the equipment because you're in the hospital. So you have your weights. Now, I've had people say, well, Julie, like, isn't that tough to carry around? And I say, yes, it is tough. It's heavy. But who else would want to be able to go rucking through the hospital with weights more than fitness forward clinicians who are here listening this morning? I thought it was awesome. I felt like I was getting a lot of fitness in by carrying this stuff around throughout the hospital all day. Okay, so after weights, you're going to have a whiteboard. Okay, I'm using a whiteboard right now for my talking notes for this podcast. You all are going to want to use a whiteboard to create workouts with your patient. So have your dry erase markers, and as you are digging into their meaningful goals and you're coming up with functional movements that match those meaningful goals, you are writing this stuff down, you are coming up with reps and sets, you are doing this with your patient. Now, I will say, you're not going to buy these and leave these in patients' rooms, right? This stays with you, okay? You could take a picture of this and give it to your patient, or the really cool thing about acute care is that they typically have whiteboards in the patient's rooms, and they're usually filled with some random information. Many times they are covered up with call, don't fall signs. Those become great whiteboards, okay? So I usually, they're not helpful. We all can agree that call, don't fall signs are not something that prevents somebody from falling. So they're great whiteboards. So I would take those down, turn them around, and with my dry erase markers, write down the whiteboard on those signs. Then I would leave that in the patient's room. Maybe I would go find a couple extras, and I would put some motivational phrases on there. Like, I remember one very specifically, I'm trying to kick COVID's ass so I can get home and chop wood. Something like that. Or something that lets the providers know a little bit more about this patient. Their name is something that I always put on these signs. Their name and something about them. A goal, an interesting fact. I want to try and have every provider who walks into the room treat this person a little bit more like a human than a number or a diagnosis. And that's a way to do that. So whiteboard / use the hospital whiteboards. Use those signs that are all around the room, turn them over, use those as your whiteboard. Okay, next, resistance band and TheraBands. Okay, so both. So resistance band is something like this, okay? These offer a lot more resistance than a TheraBand. However, I usually would bring a bag of TheraBands because I want to be able to leave some with patients, right? You can do endless things with the TheraBands. I would tie them to the bed rails many times. So even folks who are typically, they're just lying supine majority of the day because they're so deconditioned, you can tie those around on the bed rails. They can pull from above, they can pull from the side. There's a lot of stuff you can do with them, just tying them to the bed rails. With the resistance bands, this is where I would many times get people up into standing, and I would do something like a Palloff press. So if they're standing here and this is attached to the bed rail, I can have them do a Palloff press to work some core. I can have them do some rotations. You can do rows. You can do a whole bunch of stuff with those resistance bands, but those come with me. I'm not leaving those in the room. Okay, next are sticky notes. Okay, sticky notes are amazing because they're versatile. So I have sticky notes, and then even better than sticky notes, I have a really bright note card. And then I've also used paint swatches that you can get for free at Lowe's or Home Depot. Okay, so what I do with sticky notes or these things, they become targets, right? So if I'm going to have folks be reaching for things or stepping to things, and maybe I'm calling out colors, or I will write on a sticky note a number, and then they're not only doing a motor task, they're also doing a cognitive dual task, perhaps. These are great tools. They're light, they're easy, they're cheap. The other thing I like with the sticky notes is I'd like to put little notes on them for people. So if I'm using targets with a sticky note, perhaps to show them exactly where I want them to do their deadlift, put the weight pick the weight up from and put it down on, I will put a note here that just says like, you're a badass, or never give up, or something like that. And then that's something that the patient can keep. So they're wonderful for targets. They are wonderful to do some dual tasking. So you can have people reach for yellow or reach for a number that is written on one of the colors. So you could yell at the color or the number. Very versatile tools, very easy to carry around with you. All right, and then also, obviously a gait belt. You need to have a gait belt for obvious reasons, for safety, but also I have used a gait belt before, and I have put it around the bed rail. And okay, I have never ripped a bed rail off of anything by putting a gait belt around it and tugging on it. Okay, so I'll just say that. Are they the most sturdy things in the world? No, I've never ripped one off. So that's my preface there. But I have looped this around the bed rail, and then perhaps someone is sitting in a wheelchair and they have a really hard time just sitting up tall in their wheelchair. Their core is very weak. I will do almost a modified rope climb where the gait belt is around the bed rail and they are pulling themselves up to sit tall and then going back to the back of their seat, the back of their wheelchair, and then pulling themselves up to sit tall. I've done this in home health where I loop this to the end of the bed frame. What am I calling it? Footboard. But typically in acute care, there really isn't a big enough space in those footboards. Maybe some of them, but definitely a really cool tool to use to do a modified rope climb, really get that core activated for someone who is so weak that they barely can even sit tall in their wheelchair. Okay, and then lastly, you need snacks, okay? Don't forget your snacks. I became so much more efficient and so much more productive when I started bringing food up on the floor with me and putting that in my backpack. So get you some nuts, get you a bar, a little bit of healthy sugars, maybe I always had like clementines or mandarins. Those are one of my favorite snacks. Make sure that you have some fuel so you are not having to really put a big stop in the middle of your day. You're not going down to the cafeteria, getting crappy cafeteria food, and it just kind of keeps you focused. When you take that break and go down to get a snack or a coffee, I think it just puts you in that mindset of like, I'm going to just chill and not work as hard, when you just keep hammering throughout your day and you're able to do that because you have fuel, it's really important. Okay, so that is what I put in my backpack, all right? So let's talk about some specific acute care hacks to load up your patients when you don't use the weights, okay? So let's throw the weights out. My favorite hack, one of them, is to use towels, all right? Now, this is a towel that I have soaked in water, all right? Because a soaked up towel is really heavy compared to a towel that's not soaked in water. So I will roll a towel up and I will put it in the toiletry buckets that are in every single patient's room. So usually these buckets come with soaps and little doodads, things like that. I just get rid of that and I soak up towels and I put them in the basin. Now, you can do a whole bunch of stuff with this. So for someone even in sitting, even having to hold on to this basin can be very challenging. We can increase the difficulty by going overhead. We can increase the difficulty by doing some marching in sitting. We can do a deadlift from sitting. We can then get up into standing and we can do a deadlift as well. So the great thing about this is it's a great way to introduce the hinge to a patient who is post-op lumbar fusion. Yes, I am loading up someone who is post-op lumbar fusion day one. Why? Because they're going to be discharged. They were probably never taught how to do a hinge in the first place, which contributed to them ending up having surgery. And I want to be the person to break that cycle, right? They're going to go home. They got to empty the dishwasher, lift up Fluffy's kitty litter box, whatever it is. Why not teach them here and now? So I will put the towel in the basin, and then I will teach them how to properly hinge with an elevated surface in the basin. So I'm teaching them a hinge pattern, loading it up a little bit so that they know how to properly hinge when they go home, okay? Endless amounts of things you can do with that basin. The next piece of equipment that I love are your bedside commode buckets. Yes, the things that poop literally usually goes in. But this is not what we're using them for. We are using clean bedside commode buckets, okay? So the cool thing, buckets, they usually have a handle, okay? So it makes it a lot easier to hold on to than potentially the basin. So what I will do is I will put a bunch of crap in the bucket. So I will put my weights in there, or I will go and get a bunch of ankle weights because typically therapy departments in acute care have ankle weights, put them in the bucket, and now we got some load. So you can do the same thing. You can deadlift with the bucket, okay? You could do my favorite, which are carries, okay? So loaded carries. So as you're walking with your patient, they could carry on to the bucket. And the cool thing is that it adds a little bit of a perturbation, okay? So they're getting an internal perturbation just by holding on to an object. There's a truck coming by, I'm sorry. I am out in my garage and there is construction going on in my neighborhood and it's disruptive. So I'm gonna wait until they go by. Okay, they're hanging out. I'm just gonna talk louder. Okay, so with the bucket, come on, my friends. Keep it moving. Keep it moving. Don't they know I'm on a live podcast? Okay, with the bucket, what you can do is if someone is non-ambulatory, they can hold on to the bed rail and they can go like this, back and forth with that bedside commode bucket full of equipment and full of weights, okay? They could hold on to it, hold on to the bed rail and march just like this. They can swing that bucket forward and backwards. There's a lot of things you can do with the bedside commode buckets to add in a little bit of a perturbation. Okay, lastly, we'll talk a little bit about how to put all this stuff together. So when you are with your whiteboard, right, and you're talking and you're sitting with your patient and you're figuring what movements that you're going to do, this is where you can start introducing what an EMOM is, every minute on the minute. You could start introducing what a rounds for time is. So very, very early on, typically patients don't hear about this stuff or feel what intensity is like or load until they're way into their journey and they go into outpatient potentially, right? So the amazing thing is that you get to start introducing them to what a workout is like this early on. Imagine that seed that you've planted, then your patient will understand what it's like to lift heavy and to work hard. They go to home health or they go to inpatient rehab and then they go to outpatient and they're able to advocate for themselves and understand, okay, this is too easy. I don't need that yellow TheraBand, or I'm not working hard enough. This isn't challenging enough for me. You are able to give them that opportunity, which is absolutely amazing. And remember, you can be the one that has an impact on them farther down the road. You are not going to see that sexy discharge, but you were able to be the catalyst to spark some change. Okay. All right, my friends, that is all. The next time I come on here, I will actually show you an example of like an EMOM or a rounds for time, some examples of what I would actually do with patients in acute care. I will also, on the ICE stories, I will post some of my reels I made back when I was in acute care, going back into the archives. I will post on our story my reels that show some of this stuff in action. Okay. All right. So lastly, talking about our courses that are coming up. MMOA Live will be in Alabama. We will be in Minnesota, Wyoming, and Oregon for the rest, not the rest of September. We're not in September yet, but in September. So many opportunities to catch us live on the road. All right, everyone, have a wonderful rest of your Wednesday.